Hirshenson here at Triangle Veterinary Referral Hospital. I'm one of the surgeons here, and I'm here with Nadira, who's one of our technicians, and Foster, who's getting here ready for surgery. A lot of owners can be very apprehensive about the whole surgical process, so today we're just going to do a very brief run-through of what you can expect when your pet's dropped off for surgery, just to hopefully ease a little bit of the apprehension and nervousness that you may feel. So right now, we're just at our initial setup. We're just going to get things prepped and ready to go. Oftentimes we'll get an intravenous catheter, and we want to do that so that way we can administer medications, fluids, and undergo anesthesia very, very safely for your pet. Right now we have an anesthetic machine and a monitoring equipment set up, and these are very similar to what you would expect in your own hospital. Things that if you're undergoing anesthesia or procedure, you would expect very close monitoring, and we're going to do that for your pet as well. Now, once we move into the operating room, your pet's going to continue to be monitored very, very closely. So you can see we have a very similar setup to how we had outside, where we're going to be monitoring the anesthesia, their blood pressure, their heart rate, respiration, all of that stuff. In the operating room, we have equipment necessary to perform orthopedic, soft tissue, and emergency surgeries. So anything we actually need for the procedure, we're going to have with us in the operating room. Now, I can't walk you in specifically because we keep it very sterile, but everything that you would expect for your own surgery and sterility and cleanliness, we provide here at TVRH as well. Following surgery, we want to make sure that your pet is comfortable and recovering as it should. And so typically we will bring them over to their run, where they'll be in a nice padded area where they can recover, pain-free, where we can keep them on fluids, pain medications, any supportive care they need, and very closely monitored by the doctors and the veterinary technicians on staff. So during your discharge, we will go over all the instructions, we'll make sure that you're comfortable with your at-home plan, and talk about any further rechecks that may be necessary. It's really important to keep those rechecks either with us or with your primary veterinarian to make sure that your pet is recovering as it should. So that may be as simple as just removing sutures or staples from the incision, or in some cases more additional follow-up regarding bandage changes or even x-rays later on as the healing progresses.